Okay. Good morning, good afternoon, good evening, everyone. We'd like to welcome you today to a session entitled Funding the Future, Diversification and Next Steps for FGM Programming. A big welcome to all. And we would like to start by first noting that there are 4 years left to end FGM. We are living in interesting times where the financial contributions to the joint program and two partners have faced drastic reductions. This requires moving towards diversified financing in bold steps. So this webinar today is a step to strengthen these steps forward. We will start by having a session through Financing for Development specialist, Federico. And this would be followed by country examples from Ethiopia and the Gambia to demonstrate the steps they have done to diversify funding for FGM programming. And then we will have a session for questions and answers, and we will close. So the hope here is to share what is happening on the ground, the lessons learned, and from colleagues on the ground and elsewhere, and then have next steps. So without much ado, I'd like to welcome our colleague Federico to start us off. Over to you, Federico.
Thank you very much. Can you hear me well?
Yes.
Okay. Thank you very much for this opportunity to share with you a few ideas about diversifying funds. I will try to share my screen. Please let me know if you can see it.
Yes.
Okay. Well, the first thing that I would like to share with you is that we can identify three main complementary objectives of sustainable financing. The first is spending more, the second objective is spending better, and the third is diversifying sources. Three of the UNFPA, the four UNFPA indicators for the output three, sustainable financing, are focused on funding diversification. And the aim is to build resilient financing mechanisms for the transformative results. That means reducing the risk of disruption by diversifying this risk. Having more than 60% of the budget relying on just one source is too risky for every intervention. So UNFPA has a financing for development strategy with 4 pillars, and its theory of change proposed that we can advance towards sustainable financing by promoting an evidence-based policy dialogue. I also propose that we can differentiate among 3 phases or consecutive tasks in making the case for raising investments in the transformative results. The first task is to develop evidence to inform this evidence-based policy dialogue. Here, the investment gates are our main stars, but not the only one, because we can use other pieces of evidence like policy brief, fact sheets, public expenditure review. In cases where there is a specific public investments, we can advocate not only for raising resources, but also we can try to show countries how to get more value for the available resources. At this first stage, the challenge remains technical. I mean, producing the evidence is a technical issue. We can hire a consultant, we can request regional support or even headquarters support. But the second stage requires reps involvement, and the third stage, it means turning the narrative into concrete commitments is absolutely political. We cannot hire this ability in the market. The ugly truth is UNFPA is really advanced in making investment cases, but not yet in making the case for raising domestic resources. And the magic happens only when we can take economic evidence and turn it into investment opportunities that results attractive for donors, for governments, or other stakeholders. And we also need to take this opportunity to obtain concrete commitments. So these are the tasks in sustainable financing. And as you can see, it is political rather than technical. I like to say that the meaning of the shifting from funding to financing is turning our reps into budget fighters. What we know so far? What evidence do we have so far? We have a global assessment of the cost of reaching the transformative result that also includes FGM. There is also a useful online tool for costing FGM that was developed by WHO. So we know that eliminating FGM is expensive. We have an estimated cost per girl. We know that sources for financing FGM reduction remains relying mostly on donor support, and we have an assessment of donors' investment in many countries. And we realize that if we continue to rely entirely on donor support, we will need to quadruple, quintuply, or multiply by many times the amounts allocated for in FGM. So we are far from reaching the goal for 2030. In addition to that, another challenge is that donors' allocations are not only insufficient, but also oscillating. And the problem is that fluctuations in funding affect the efficiency of the interventions. First, there are sunk costs that needs to be repeated or duplicated each time there is a disruption. Second, there is an opportunity cost that is being lost if we discontinue intervention. And third, there are hard to reach tasks such as Norman Challenge that require sustained efforts to yield results. So in a nutshell, volatile financing reduces the efficiency and impact of every dollar invested. Do you remember that I mentioned that there are three complementary objectives: spending more, spending better, and diversifying sources? Where oscillation make us spend worse, because the more predictable the allocations, the more efficient the financing will be. So we need to work also in advocating for more stable allocations from donors, in addition to diversified funding. And this is the roadmap for diversifying financing for harmful practice, and particularly for FGM. Reaching sustainable financing requires having more predictable and stable allocations. We ideally will have our market sources. For instance, maybe many of you know that Guatemala has a dedicated tax on alcoholic beverage for supporting reproductive health initiatives. El Salvador, also in Latin America, is proposing a tourism tax to finance harmful practice. But we all know that this is very hard to reach, and our alternative now is just trying to diversify the available sources. However, we realize that we cannot expect to secure public budget allocations in countries with insufficient fiscal space. So the first thing we must do is to assess if there is enough fiscal space in the country. Where tax revenues are below 15% of the GDP, we can easily conclude that there is insufficient fiscal space. So we don't need to hire a consultancy. If tax revenues is under 15 of GDP, we hardly could persuade the government to spend in FGM. And all countries are included now in a dashboard, and a public financing dashboard that includes this sort of data. So it is available. This data is available. In countries with insufficient fiscal space, we can opt to involve international financing institutions. In this case, the challenge is deploying UNFPA normative role to define how to spend funds more effectively and ensure results. We must remember that presenting results-based initiatives could be always appealing for international financing institutions and non-traditional partners. In this case, the message could be UNFPA can deliver results with the concessional funds that this institution could provide. In the cases where there is enough fiscal space, we can promote this evidence-based policy dialogue that I mentioned at the beginning, developing the evidence, making the narrative, and trying to promote commitments. Nevertheless, in the three pathways, in leveraging domestic resources, in engage international financing institutions, and mobilizing non-traditional partners, we always need to define metrics to assess intervention, to assess the intervention effectiveness, and to cost them. So these are tasks that we will need to deploy from now on and forever. Finally, the most relevant message I want to share is that this journey is not a technical discussion. It is political. It is a political battle geared toward economic arguments. What we can provide you are the economic arguments, but the battle is a political battle, and we need to involve our representatives, our deputy reps, and if we can, our regional directors and deputy directors. This is what I wanted to share with you. Thank you.
Thank you so much, Federico. This is really great guidance on, what to do on the ground in diversifying financing. So I'd like to invite our next speaker from Ethiopia to share with us what is their country experience in trying to diversify financing. So I'd like to welcome Tinos to share their experiences. So over to you, Tinos. Thank you, Federico.
You're welcome.
Can we remove the presentation? We probably have to upload.
Good afternoon, everyone. Thank you, Dr. Wissal and Federico, for setting up. My name is Tinos Kabada. I'm the Gender Equality and Social Norms Program Specialist in Ethiopia, country office with UNFPA. I'm here with my colleague, Leila. So I will display our presentation to share our experience. Is it visible?
Yes, thank you.
All right.
The slide, there is a small caption. That's it. Perfect.
Is it good now? All right.
Yes.
Okay, thank you so much for this opportunity. This is just to share some of our approach in strengthening FGM programming in the country through looking at different resource diversification and some strategic partnership experiences. So I'll go through a few components to showcase how we brought our overall country program, how we look at some of the funding diversification structures, how our program funding really looks like from different stakeholder perspectives, some lesson learned, and some way forwards. Just to start with, the Ethiopian Country Office started the 10th country program from July 2025, that will go through 5 years till 2030, which was developed in a bit different approach than the previous country programs. This is to showcase that all our programmatic outputs are not as such set up in a silo form like we used to do, like sexual reproductive health, GBV, harmful practice separately, but more of an integrated approach where we brought different components around sexual reproductive health and GBV in terms of demand creation, linkage to services, coordination, advocacy, data, and evidence generation. That aligns, of course, with our global strategic plan that automatically contributes to the 3 UNFPA transformative results. So this approach really brought us the first step in bringing diverse partnership, diverse way of looking at the different components together so that our investments as well as our provision of services are in an integrated package. Looking at some of the Ethiopian program areas, this is to showcase, our current joint program on ending child marriage, on ending FGM, and the non-JP program areas. As you can see in yellow, these are the areas where the joint program on ending FGM is investing, where there is a high prevalence rate of FGM. As you can see, the light green sections are also intervention of the joint program of the child marriage, which complements the work that we do as we use an integrated kind of approach. We also have and then JP program area in blue areas where we complement it with the different programs that we do. So I think it's important to really emphasize what Federico was emphasizing around how the financial landscape is really decreasing, but the demand and the expectation to meet the SDGs is very high. And in order to accelerate, for example, Ethiopia is expected to accelerate 5 times to reach our commitment as a country. The demand is very high, the country is huge. So looking at the different funding approaches and strategies are very important. Looking at the different stakeholders, so our major components when we talk about bringing FGM, because FGM is not just a one-phased kind of issue. It is a multi-phased challenge that we have, that we need to engage different partners, different stakeholders to really invest so that we have more of a comprehensive kind of outcome. So the government is the lead organization in the country. Of course, the Ministry of Women and Social Affairs being the lead, but also the Ministry of Health, the Ministry of Justice and Education, and of course other sectoral bureaus are also play a great role. What I wanted to showcase here is the important opportunity as a country that we have a different structure at the government level, where we have the federal level, where we play a lot of advocacy policy role, where the government is leading and committed for. At the regional level, we also have the coordination mechanisms to really bring that engagement and integration of FGM, both in the prevention and response areas. What we call at zonal, Wereda, and Kabale level are the lower districts where implementations are happening. One of, I think, the best opportunity in Ethiopia is the structure of health extension workers under the health component and the women development agencies under the women and social affairs structures that are actually on the ground doing the community mobilization within communities in rural and urban areas that we also use as one of our strategic mechanisms to have a sustainable kind of engagement. Of course, we have the development partners. When we say development partners, of course, we have the donors who support financial support for the JP and then JP programs, but we also have development partners who support us in advocating the issue of FGM, because FGM, we have a big push in the country from the different opposers. So it's really important to have development partners who advocate on the issues, to make changes, to mobilize more resources. We also are having different strategic partnerships with private sectors. I will come a little bit later on this, engaging private sectors to engage in funding. And of course, we also had a good experience on fundraising campaigns. Last year, we did a good fundraising on obstetric fistula, which gave us the opportunity to learn on how to bring in private sectors to really look forward to the different development partners and government and civil society organizations to really bring in all those components together. So this is the country program funding for diversification that we really wanted to show. These are one of the major programs that we have as a country. Of course, that complements the work that we do on FGM. So the first one, as you see, is the Global Joint ECM project, that is Ending Child Marriage Project, because the regions that we are implementing are different from FGM, but the interventions, the approaches, the strategies that we're using really help us to integrate both ECM and FGM components in terms of demand creation and, of course, service provisions as well. Protecting the dignity and rights of women. This is a multi-year program funded by Canada. It started end of 2024 that goes through 2030. It's a long year nexus project that is on development and humanitarian area, bringing in GBV, sexual reproductive health, harmful practices, and livelihood components. So it's a huge project, a huge fund that really gave us the leverage to really reach Weredas and communities that are not reached through the joint program initiatives. We also have funding from other development partners like Quaker for 3 years, focusing on young people in Afar and the southern part where FGM is really high. This will give us the opportunity to really focus on in and out of school use, on bringing SRH and comprehensive sexuality education for young people to change the community behavior. Empowered is also a Global Canada program funded for different countries, where Ethiopia is also implementing 5 regions that also focuses on young people. It has an integration of GBV and harmful practices, which gave us the leverage as well. We have other complementary funds like the UNA Sweden supporting in one region that complements the FGM program that we do. We also have a new project funded by European Union and Spanish cooperation, which is called Gender Machinery Project. So just to give you an idea what gender machinery means, is where all the government sectoral ministries and all the structures in the government working on gender equality and women empowerment. This is a system strengthening project that complements all the other programs that we do when we come to advancing women and girls programs, say it's FGM, child marriage, GBV programs. So this is a very strategic project that we just started this year that really will help us coordinate and build the capacities of government that will complement the program. We also have an innovative project testing mobile health and nutrition clinics funded by Gates Foundation, a philanthropy organization, where we implemented in those pastoral areas, hard to reach areas like Afar, some part of Oromia and Somali, where it is very hard to reach communities because they are mobile communities. So we brought this innovative project called Mobile Health Clinics, where it integrates SRH, maternal health, FGM, child marriage, GBV components, where we have health professionals within the health and the health extension workers in those mobile health clinics reaching those communities. Of course, we do have also a partnership with private sectors like the Japan private sector like Itochu, Safaricom partnership. I'll come a little bit later on this. That really supports the menstrual hygiene programs that also integrates vulnerable women and girls in communities that we work on FGM and child marriage project areas. This slide is more or less to bring in all our strategies in terms of bringing diversified kind of resources. Of course, we have the financing development partners, expanding those partnership opportunities to private sectors as well. So bringing in, those joint kind of initiatives, not only relying on development partners, but also bringing private sectors and the governments to sustain the programs that we do. Expanding beneficiary reach and communities. As you know, the FGM, the 2 first pillars on the joint program is investing on girls, women, family, and community. Almost 70% of our investment goes to this, which really brings the change in the communities and the individual level. So this is an area that we really invest and make sure that we are making changes. Organizational visibility, we found it very important because in the past 2 years, what we did was we brought head of missions of different development partners together with other agencies to showcase the work that we do at community level. That really brought the opportunity to showcase our work, how it integrated work that we do. And as UNFPA, we're mandated to also make sure that we bring in the health aspects of FGM, making sure that health system strengthening is really a part of what we showcase for donors, so that this helped us to advocate to mobilize more funds, reducing funding risk and greater sustainability. Of course, government is the lead organization. We support all structures of government to make sure that FGM is invested both in prevention and provision. Localization, of course, almost 80%.
Tinos,
Yes.
you have only 1 minute left, so please.
I will finalize. Yes. Thank you so much. And localization, women-led and youth-led organization and structures are our priority to make sure that our programs are also sustained. One of the best practices lessons that I tried to mention earlier, from 25 on, we had this partnership with the government of Japan, together with private sector like Itochu and Safaricom, bringing vulnerable women in communities where we work on FGM, child marriage, and GBV to get the opportunity of livelihood through technical expertise and access to finances. So not only that they are empowered economically, but also access different finances so that they make the ability to be empowered and make decisions. Coordination mechanisms are also important for us. We have the government, the donor platforms, the humanitarian platforms, and of course the sectoral bureaus that we always update on where we are on investments of FGM, child marriage, and all the integrated programs that we do. Way forward, the major shift that we did was shifting from short-term to long-term kind of programming, where the short-term deliverables are now, we're shifting to more of long-term program investments, bringing different stakeholders. System strengthening is also one of our major investment area that we're focusing, capacitating, and making sure ownership and accountabilities are at government to sustain the program, and moving toward localization is our priority. Thank you so much for listening.
Thanks, Tino, so much. I would like to invite the Gambia to share their experiences in finance diversification, and then open the floor for questions to the panelists and then comments. Thank you. Thank you so much. Over to Natasha, please, to give us a feel of what has been happening there with regards to financing diversification. Over to you, Natasha.
Thank you very much, Wisal, and a warm welcome to all colleagues on the call. My name is Natasha Kulshresh, and I'm the Partnerships Manager here at UNICEF Gambia. I'm standing in for Emmanuel Michon, who is the Child Protection Program Manager, and I think he's known to some of the colleagues on the call. But it gives me great pleasure, and it's been very, very interesting hearing colleagues like Federico and Tinos share their experience. I don't have a presentation, but I wanted to come here today and share with the group two key examples that we have of how we've leveraged further funding purely based on the work that we're doing under the United Nations Joint Program, under the UNJP, and how that's enabled us to really tap into pockets of funding that we couldn't before. So the first example that I have is of the Canadian National Committee, so the Canadian NatCom for UNICEF, who first got interested in our work in the Gambia, in our work around FGM in 2024. So some of you might know that here in the Gambia, FGM was legally banned in the year 2015. However, unfortunately, in the year 2024, there was a demand to repeal that ban and to legalize FGM, which was obviously not ideal. And there was a lot of work that was done both by UNICEF and other UN agencies to change that. And this was what attracted our Canadian colleagues, and they wanted to know more about our work here. What was really important to note here is that thanks to the UNJP that was in existence that we were working on, UNICEF had robust interventions already in country, and we had already done a lot of work, and we were key players when it came to sort of interventions related to FGM. And I think this put us in a very, very good position with the Canadians to really request for their help to then upscale it. They were generous enough to give a contribution to our thematic pot, which again was incredibly good because, of course, these are flexible fundings that UNICEF can use. And this was very, very interesting, and of course would not have happened if we were not already working with the UNJP and not already part of that FGM intervention scene. Again, what was really interesting was on the Canadian side, given all the work that UNICEF had done and given all the work that we were doing with the thematic funding, the Canadians were then able to leverage and tap into other sort of specific Canadian women networks to then further contribute to this FGM cause, further contribute to the thematic pot. So through this, it almost became a chain catalyst, if I may call it that, of getting further funding for FGM and also for the Canadian NatCom. So this was a great example. The second thing that I think is a good example to mention is how the funding from the UNJP has really enabled us to pilot new things. So with the current funding that we have developed an SPC strategy for the abandonment of FGM in Gambia, so social behavioral change strategy. This has been developed with the funding used from the UNJP in collaboration with the Ministry of Gender, Children and Social Welfare, which is our nodal ministry here in the Gambia, and also local partners. What's really interesting is that this strategy presents very comprehensive evidence. And again, we've been able to do this because of the funding that we have from the UNJP. So it has really comprehensive evidence-based approaches and interventions that aim to achieve genuine SPC change. And of course, it engages a variety of key stakeholders like religious leaders, young people, other UN agencies. And also what the strategy has is a clear implementation plan and monitoring and evaluation framework. So this framework then enables us to achieve really tangible results, not only just achieve them, but also monitor them. So for us now, this plan becomes almost phase 2 of that strategy. And what we're doing, just like we did with the Canadians in the previous example that I mentioned, we are working with other NatComs, other national committees, in particular the German National Committee, who have now pledged funding specifically for the implementation and monitoring plan of this social behavioral change strategy. So again, thanks to the UNJP, we were able to create the strategy, and now we are attracting other donors and other resources to take this forward. So I thought I'll bring these two examples to the group as tangible examples of how we've been able to diversify funding and continue to do so. And yeah, very happy to answer any questions. Thank you once again, Rizal, for the opportunity to speak.
Thanks so much, Natasha, for your intervention. A lot of lessons learned, or rather experiences from both Ethiopia and Gambia, and I am seeing some questions being posed. So may I ask the panelists, Federico, Tinos, and also Natasha, to share your responses to some of the questions posed. One question was, can you elaborate or share your experience working with the private sector? FGM being a not so attractive issue, how did you manage, or how can you engage the private sector on this issue that might not be attractive to them? So open the floor to you all. Thank you.
Can I come in?
Oh yeah,
yes,
go on,
please,
go on.
go ahead. Go ahead, and then
Let me
Natasha.
just start, just to reflect, because it is true. The area around FGM is very sensitive, especially when you come to Ethiopia. There is a lot of pushbacks around it because of different opposers. So it's not always an area private sectors are fully aware of or will be interested. So the first step to really bring in our issues, not only FGM, but what we do is we bring in all the mandate areas of UNFPA, because health is our entry point around making sure that women and girls are accessing health services in terms of all aspects. And FGM, of course, has a health issue, psychosocial aspect, and of course the legal aspect as well. So having that discussion, creating awareness through social medias, different one-on-one meetings with the private sectors, it really takes time, because we had a good experience last year bringing the obstetric fistula issues and also bringing other issues like FGM, child marriage, and others with the private sectors to really bring in what it means and what that funding really will bring. So it needs a lot of work. It's not like any other stakeholder, but doing that pre-work in terms of making sure that they have the returns as well, in terms of their social corporate responsibility, as well as making sure that we also engage it with empowerment. So livelihood is also a component that is really important, because it's something tangible, something that they see, and the impact is not just economical empowerment, but has also more of a broader impact to it. Just to start the reflection. Thank you.
Thanks so much. So, Tinos, just to again reiterate, know the focus of the private sector, their areas of interest, package the FGM interventions within their priorities. I think is the main takeaway, and also be opportunistic if there is an area, integrate into it. Natasha, over to you.
Yes, thank you. Yes, very similar to what Tinos said. The only thing here in the Gambia is our private sector is very small and very limited. We are a very small country of 2.4 million population. 54% of the population is under 19. So the private sector footprint here is limited. One of the key things that we have done is to attract that private sector by working very closely with our national committees, by working very closely with our global offices. Here in the country, we have managed to attract private sector through our advocacy around FGM, and not just like Tinos was saying, not just FGM, but also the kind of harmful practices for children. So that's FGM, child marriage. So yes, so we've sort of been able to attract a bit around that, especially the telecom companies that are present here in the Gambia. So with an advocacy campaign or using their brand color purple, things like that. We've also had a private-public partnerships dialogue last year. We hosted that here in the Gambia along with the Embassy of Japan, who are our major funders, not particularly for FGM, but just in general. And that was a very good opportunity to almost map the private sector here and to see who is interested in what kind of causes and how we can work more efficiently with the private sector. And then, of course, in the follow-up conversations, there are organizations, especially women-centered organizations, child-centered organizations, that are very interested in working against these harmful practices and social behavioral change here in the Gambia. So it's these sort of avenues to capitalize the funding. But again, I'll go back to saying that the UNJP that we have enables us to do that because it gives us a very strong grounding, a very strong launch pad that we can then work with other donors and enhance it. So thank you.
Excellent. So yes, leverage on the joint program results, advocacy, know the private sector, who they are, what their interests are, I think are key here, messages from both Natasha and from Tinos. There is a question to you, Federico, about the fiscal space. Given that most governments are working within narrow fiscal space, and you gave a threshold of 15%, there is a question here is, can't we not also negotiate this very narrow, fiscal space to try to look at places where existing government funded programs could take up FGM interventions? Is there a space to also go beyond federal down to subnational and local area where you can also negotiate within governmental spending to integrate FGM interventions there? Over to you, Federico, and colleagues on this question. Thank you.
Okay, thank you for the question. This threshold that I mentioned of 15% of the GDP in tax collection is just indicative. It is not written in stone. And if there is a country with a tiny fiscal space, but where the country or the government is committed with FGM, of course, we need to work with them. And if there is a local government or a local area in which it is feasible, we need to work with them. Of course, we have to do that. And in addition to that, I would like to mention, I can't answer to the first question because I never worked in the field. But if I had to persuade a private investor about the convenience of investing in FGM, I would say, if you want to have a market, a growing market in the future, the only way is incorporating women in the labor market and in the society. So you will hardly find something equivalent, something so cost efficient like investing in reducing FGM. So this is, from my perspective, the most appealing point we have. If we have the opportunity of talking with governments, we can say that. But the problem we have usually with government is governments hardly will be thinking in the long term. We can easily talk about the long term with international financing institutions, with private sector, and with donors, rather than with governments, because governments are looking for the next election. So this is the hard part of working with government. But if we have an interlocutor, or if we have someone that is receptive to our arguments, of course we have to use them, even if the fiscal space is teeny. Over to you, Wissam.
Just because there's a lot of questions coming in, there is a question about what is the experience of countries in diversifying financing to other partners, right? You know, how did you support other implementers, whether they are governments, whether they're CSOs, and other partners, to advance their financing? Is there any experience to share here? And there's also another question about, you know, what about countries where the joint program does not exist? How do you leverage, or how do you bring in sort of like financing to support their FGM efforts there? Difficult questions, but I think these are things that we need to at least reflect on and try to respond. So I'm opening the floor to the panelists to respond to this. Thank you.
I can pick up the question around working with the government. I probably won't be able to speak on a country where UNGP doesn't exist. But so for us, the sort of threat, the repeal of the ban was almost a horrible wake-up call. Since FGM was illegal here in the Gambia, I feel that there was almost a sense of calm and lull where you thought it's illegal and that's fine. And then, of course, in 2023, there was a case that came forward where 3 women were accused of FGM on, I think, around 11 girls. And they were, of course, fined and, you know, put in jail. And then there was a whole uproar against that. And I think that was a wake-up call where UN agencies, as well as civil society organizations, including the government, really realized that even though we had the law, that in terms of social behavioral change and social acceptance, that it was far from you know, at the level where the law could be implemented. So I think in the kind of fight against FGM, in mobilizing resources and having those interventions that really tackle the problem, we started from a good place in the sense that government agencies, other CSO partners, other UN agencies were very much against FGM and were very much in favor of keeping the law and not reappealing it. So I think that kind of really gave us good grounding from where we could have really prominent and significant discussions. During the time when the law was threatened to be reappealed, we worked extremely closely with the British High Commission here, who hosted seminars in country, webinars, and really put their voice behind behind keeping FGM as illegal, and how this is, they went ahead and said that this is violence against women. It's not just a child rights issue, it's a much broader issue, and it's violence. So I guess because of that, we could really leverage that support, and we're working very closely now with the government for public financing for children. FGM is a part of it, but it is more broader than that. It's working within the health sector, working within the education sector, and definitely around FGM. The government is very receptive of what we have to say. So sorry, it was a bit of a long-winded answer, but just to give you the context of how, for us, that piece is easy. So thank you.
Thank you. So sometimes you get lucky in
Indeed.
context where, yes, where the government now steps in and takes the leadership, as you said, and directs financing on FGM. What about other players? Has there been, ways where, for example, and maybe that does not apply to the country cases. Federico, maybe mute. Yes, where let's say you try to leverage through IFIs, as how Federico said, so that, for example, the government could benefit, where CSOs' capacities or support them in finding financial, submitting financial proposals, gaining traction from different donors, private, ODA related funding. So are there any experiences from these specific countries joining us today to share on this?
I can come in, but I suppose I'll let Tinos respond. I've been speaking quite a lot. So Tinos, if you wanted to come in, otherwise I could respond as well.
Just I'll start it off. You'll complement. Now, bringing the implementing partners, especially the women-led organizations and the local civil society organizations, one of the approaches that we used is bringing our implementing partner, private sectors, the governments to come together, have our different comparative intervention sections, so that we bring in a more of a coordinated kind of results that really brings them to really engage, capacitate in terms of engagement with private sectors and other kind of modalities. But I've seen that implementing partners are usually good in bringing foundations to support them, diaspora foundations and many others. One of the limitations here is the sustainability. It's usually a short-term kind of engagement, short-term kind of work, but we've seen in our gender-based violence program, specifically engaging survivors of GBV to get different job opportunities in different private sector platforms. So we're working with Chamber of Commerce, where it is a platform where it brings all private sectors together. So we're engaging with them. We're actually about to sign an MOU, a strategic MOU, so that we engage them with our implementing partners to create jobs for them, for GBV survivors, for fistula survivors, vulnerable women on FGM and child marriage, and many others. So we're still exploring and going forward, but we've seen that implementing partners have a good potential in engaging with different partners. Yeah.
Thank you. Please, Natasha.
Great, thank you. Yeah, so for me, I mean, again, very similar to what Tino said, working with implementing partners, working with local organization. I think I'd like to really mention the work UNICEF here does with an organization called WIL, which is Women in Liberation and Leadership. It's founded by this lovely lady called Dr. Fatou Balde, who's a great activist for, well, a great activist against FGM. She's an FGM survivor. She's received lots of awards as well from the UK government. And she's founded this organization, and we work very, very closely with this organization for helping survivors, but also for advocacy. I think that's key. Advocating obviously the interventions that we're doing, the need for funding to the government and to outside partners. So we really work with Will around that, and also for public financing for children, because it's a local organization with a local leader who's such a prominent leader when it comes to fight against FGM. It's a real pleasure to be able to work with this organization, and also to leverage their voice and support and capacity build them. So yes, thank you.
Excellent. We have, I think, around 3 minutes, and the questions are really flowing. And I think in case we don't manage to answer them all, maybe we will send, sort of responses to the questions posed here in the chat. And I'm going to ask the colleagues to take note of the questions that remain unanswered. There is still a question on the private sector, and maybe you just have 1 minute each. How did you address, conflict of interest and partnership with the private sector? Over to you, just 1 minute responses, and then I'll hand over to my dear colleague, Vero.
Shall I come in first quickly, or Tinos?
Please, go ahead. Go ahead.
Okay. Great. So yes, I mean, for us, in terms of working with private sector and conflict of interest, it's really in terms of anything that we do or any interaction with private sector, we heavily rely on the existing sort of due diligence and the due diligence procedure that exists within UNICEF. So it's obviously done in country, but also it's done at Geneva level. And we really rely on that to kind of know the donor's background, and of course make sure that we are, if we're working with a particular private sector entity, then they are clean, as it were. And so yes, we've been doing a lot of that. But I think for us, again, as I said before, for us it's really advocacy. We're really trying to get private sector involved with funding, of course, but the road to that is through advocacy. That's what we found out during the PPP dialogue, the public-private partnership dialogue that we had organized for all the private sector here in the Gambia, is to get in through advocacy. And of course, if a company is outwardly advocating against harmful practices like FGM and child marriage, then of course, we can explore further working with them. So that's how we've sort of managed the conflict of interest piece. Tinus, over to you.
Thank you so much. I will just compliment because it's more similar. The due diligence really worked for us as well. That's how we go. That will give us the room to understand that private sector's interests and where they want to invest as well. So we go to the area where they want to serve for their corporate social responsibility. In most cases, they want to support women and girls, vulnerable women and girls that can be showcased in loaning mechanisms and many more. So we're really exploring more around private banks are very interested in most cases loaning vulnerable women. We've seen that has been one area that really private sectors are interested to come in to get more investment from impact investments from the different banks, development banks. So that's an area that we are really focusing. Thank you.
Excellent. One final question to Federico. You talked about it being a political exercise. So the question is, how can you translate this to sort of compelling language for policymakers as you are advocating for financing? Are there tools? How can this be done? Over to you, Federico. 30 seconds. Then I hand over to Vero.
I think there are no tools, there are no just one language that fit for all purpose. You have to, as our colleagues mentioned, you have to know your interlocutors, their interests, and you have to find something that could be appealing for them. For donors countries could be reducing the cost of attending migrants. For the governments could be reducing health costs in healthcare attendant cost. For the private sector could be and the international financing institution could be the expansion of the markets and the growing of the economy in the long term. But you have to think in particularly in each case.
Excellent. So let me end here, and I hand over to Vero, please, to summarize and to close. Over to you, Vero.
Thank you so much, Wisal, and everyone who has joined this call. Maybe a huge thanks to Federico, always inspiring, and then Tinos and my colleague Natasha. I think the presentation have been very, very insightful. And I think also a challenge in terms of what do I summarize as key next steps. Everything sounded exciting, but maybe also just to agree with everyone here, the questions as well as the presenters, that diversifying funding sources for efforts to end child marriage and indeed addressing all harmful practices is critical now as the global community approaches the 2030 SDG goals, as my colleague Wisal has already mentioned during the opening, and why diversifying resources is critical. I think listening to the three, we know that donor funding continues to shrink now, and this is also coupled with a competing global crisis, climate shocks, conflict, pandemic, debt stress, which are already overcrowding the Miagra resources that are there. So we don't enjoy the luxury that we had in terms of financing on ending FGM. So what are some of the key takeaways that I've picked from the conversation? I think I like what Federico mentioned earlier on, that diversifying financing for harmful practices should take multiple pathways. And then listening to Tinos, Natasha, and the colleagues, I think we are agreeing that diversification of funding is no longer an option for us. With the evidence or justification that I've said, it is essential to make sure that we sustain long-term programmatic gains, but also protecting or ring-fencing the future for the adolescent girls who are at risk of female genital mutilation or any other harmful practices. So agreeing with the colleagues that yes, donor funding is critical, and then who are also non-traditional bilateral governments that we need to hook at global level, regional level, as well as at national level. I think I saw a comment from Liberia saying, how do we partner with a joint program? I think a joint program on FGM is a catalytic public good, also to support with the evidence that we collect, contextualize within your context, and also shape the narrative to attract donor partners, private sector, and also where government should invest more, not necessarily tapping from the joint program. So we diversify in increasing donor funding, particularly from the non-traditional partners. I think as Federico already mentioned, how do we also use the evidence that we have, the programming results that we have, to make sure that government is able to prioritize from their public financing to fund FGM and everything that is adolescent girls related. I think Tinos also mentioned clearly, including Natasha, on how we hook the private sector financing on harmful practices, and also how do we leverage on different individual givers. I think the lever here to make sure that we are able to attract private sector individual givers and many other, I think both Tinos and Natasha mentioned clearly, let us know the donor narrative and their interests. Money is out there, but are we tying our conversation on FGM in Liberia, in Gambia, in Ghana to attract the donor narrative so that they're able to resonate with what they do with the agenda for girls? And how do we package our narrative to attract the non-traditional partners? I think we've heard from Ethiopia, and Ghana that they were able to work with telecom companies. How do they know that the agenda for children, agenda for girls, and indeed FGM is an agenda for everyone, including the private sector at country level? And then also just to underscore the fact that all the previous speakers have mentioned, innovation must be matched with evidence. Evidence is there at global level, evidence is there at regional level, evidence is there within some other countries, particularly on countries where typology is the same. How do we ensure that we apply a lot of innovation to attract, particularly to these new donors, and then new financing opportunities that may not necessarily be traditional, but how we show up and enhance visibility, as Tino said, how do we showcase our work, results, to make sure that the funding that we have from the joint program only remains catalytic to attract more. And I think there was also a strong case from Natasha on case of Gambia, where use of the joint program results where they were able to attract Canada NatCom funds. So how do we enhance visibility is key. And then to ensure that our financing or our programming is sustainable, I think Ethiopia mentioned the whole issue of focusing on localization. How do we work with local partners? And then I'm also adding localization should also include, if we are unlocking domestic financing, how are we working at local level, provincial, district, and local government structures at panchayat or village level, so that localization is beyond working with a civil society organization. And then one of the critical issues that was also mentioned from the two colleagues was that how are we moving towards system strengthening on our work on ending FGM. This includes leveraging on already existing large-scale programming. Health program is already there. How do we bring FGM within those large-scale programming, not only for at-scale programming, but also for sustainability? And I think in conclusion, we need to ensure that diversification of funding, including programming, it's well coordinated within different and useful players. And then collective action from different stakeholders to make sure that we are there to show, to show up for girls, including also which are those donors, traditional, non-traditional, individual givers that should be behind our cause for ending FGM. And then lastly, I think conversation should not end here and there. How do we ensure that we continue to exchange, to continue to make sure that different funding pieces, they remain catalytic for stronger partnership and then for stronger actions? I think I liked what Natasha has mentioned. Their concrete action plan, including concrete, robust way of monitoring so that we are able to move with partners where we are showing results, where results are, and then where are we garnering more commitment is also critical for resource mobilization and to make sure that we continue to maintain the ambition to achieve SDG 5.3 and more importantly, FGM elimination across different geographies. I think if I managed to capture well from the three key powerful speakers, I think these are the key takeaways that I took note. And then as Wisara has mentioned, we are also going to package on the post-event package in terms of what Liberia, Ghana, and all of us could pick on ensuring systematic diversifying of resources amidst the shrinking of resources, but most importantly, how do we ring fence and protect the girls? How do we protect the impact that we've already registered through different intervention on ending FGM? Thank you so much. Back to you, Wisa.
Well done. Excellent summary and closing. I have nothing to add. Thank you all for your great contributions. We will share the post-meeting package with all these details. And this is not the end. We will just continue having these conversations. Thank you and have a good afternoon, morning, and evening. Thank you and bye.